Here's a harsh reality when we talk about HIV prevalence in the Philippines. There were more than 3,000 new cases reported this year, averaging a whopping 750 PLHIVs, short for people living with HIV, a month. With this being the highest recorded incidence since 1984, the need for action is evident, and PhilHealth has taken notice. Here to guide our country's PLHIV with specific benefits, we have Medical Specialist 3 and Millennium Development Goals Team Head of PhilHealth, Dr. Mary Antoinette Remonte. Thank you for joining us, Dr. Remonte.
Thank you for inviting us.
Yeah, and that opening statistic we had, can you tell us again other information that shows us that, you know, HIV really is on the rise in the Philippines, especially compared to the rest of the world?
Philippines is among the 2 or 3 countries that the incidence of HIV is increasing. The others are decreasing or zero growth already.
And do we have any reasons why that this is so high in the Philippines?
Maybe because of poor information among the Filipinos and the stigma. That's why those PLHIV do not want to disclose and do not want to go to the hospitals and clinics for screening.
Okay, which is where you come in, right?
We provide benefits for these people living with HIV. But through our benefits, the facilities, the treatment hubs can use this to disseminate information, counsel these people.
So the treatment hubs do some sort of information campaign as well at their level, no? What benefits can they get in these facilities?
We cover hospitalization. Aside from that, we have the outpatient HIV/AIDS treatment package, which is an outpatient benefit, amounts to 30,000 per year for every PhilHealth member that needs antiretroviral treatment.
Is that sufficient?
The ARVs right now is procured by the government, by the Department of Health, and PhilHealth benefit is just an additional support to control the disease. So usually it is used for laboratory tests, then for counseling, and then as a support to those that are giving care to patients with HIV.
Viral load testing?
It's included because it's part of the laboratory examination. We support or we cover those that treatment and laboratory according to the guidelines by the Department of Health.
Okay. What is the cap on the hospitalization? Because you said outpatient is 30,000 a year, hospitalization?
It depends on the case. Usually it's around, I think for one opportunistic infection, it's 11,000 or some would be 20,000. So it depends on the case.
Okay. But when you say it depends on the case, you will determine the merits of it or determine the financial need?
Because usually a person with HIV is not admitted in a hospital due to HIV. They are admitted because they have infection or they have neoplasm or cancer associated with HIV. And with that, we have corresponding amount or benefit for each case. That's what I mean.
Okay. And if a person wanted to know the details of that, where could they get access to those coverage amounts?
It's in our website, www.philhealth.gov.ph.
Very clear. In terms of availing of it, you can keep going and availing of these things as long as you're able to keep that cap. Is that how it works? Or is there a maximum number of treatments also on top of the peso value?
The benefit is a case-based payment, meaning for every patient with HIV, we pay 30,000. So there's no cap on how many times he will go to the treatment hubs, how many medicines, how many labs. But as long as our support is 30,000 per year.
Okay. What if they need more? And it exceeds the 30,000. What happens?
Yeah, that's the problem. If the cost of the laboratory is more than already exceeded our support, they will have to pay on their own.
Okay, that's the only recourse that they have, no?
Yes.
Okay. How do they now avail of it? So knowing that this exists, you even give us a site where they can see the coverage amounts. How does one go about getting these services? So
first they have to be screened. They have to be confirmed that they have HIV, and then they need the antiretroviral treatment. Those 3 things they have is determined by DOH designated treatment hubs. So once they go to the treatment hubs will provide the medicine, will describe what the laboratory test, then it's a treatment hub who will file the claim to PhilHealth.
Okay. Now that treatment hub that gives you the diagnosis that makes them eligible for availing of these benefits, does that cost become part and parcel of the benefit that is included here already, like that 30,000 already?
The diagnostic test before enrolling into the treatment is not yet covered by PhilHealth. What we cover is when they're already in the antiretroviral.
Okay, so if they're to avail of this, they're coming to PhilHealth, they need to first get the diagnosis. That's on their own. And if they're able to get that, they can now come to you.
Yes, actually it's the treatment hub who will enroll them to the treatment and will file the claim to PhilHealth.
Okay, requirements. What do they need to show to be able to avail of it apart from the diagnosis?
The treatment hub may ask them to photocopy their PhilHealth ID. Then they will have to sign a waiver that they are allowing PhilHealth to look into their records. They will also have to photocopy their treatment regimen. And of course, they will submit a proof that they are diagnosed. So they have this confirmation result.
Okay. Do they have to be X number of years paying in PhilHealth before they can avail of this?
3 out of 6 months. Then for and as well as employed member. But those that are paying their premium annually, they are covered as long as their membership is valid.
Okay. Do you have a list of these accredited hospitals on your site as well?
Yes, because it's attached in our circular. So there are actually right now there are 22 hospitals that are designated treatment hubs all over the country, and then there are also satellite treatment hubs. 6, and 4 of them are accredited as provider, but they should also have to apply for an additional service, which is providing HIV/AIDS.
Okay, is that number sufficient at this point, or are there plans to accredit more hospitals as the concern arises?
It's an issue because these treatment hubs are in rural areas, so others do not are far from it. But the Department of Health has plans to expand the number.
There's also a concern of consistency, right? So across the different treatment hubs, there have been some information that says some offer X services, the others do not. Can you please comment on that?
The treatment regimen is standard for all treatment hubs. But apparently the cost of the laboratories are not the same.
Sure.
And then, so they apply the support of PhilHealth to different things. So some would have to pay for viral load, for example. Others would have to pay for CD4 count because the costing is different, and the practice on how they utilize the PhilHealth reimbursement also varies from one treatment hub to another.
Okay. Now, this standard, and you did mention that there might be some discrepancies based on pricing, no? And how the costs are. If they do not provide the service which the beneficiary, if you will, is entitled to, what happens?
So usually when we receive complaints about this, we talk to the treatment hubs and ask what's the problem. Usually the problem is they weren't able to utilize fully the support of PhilHealth. They weren't able to file a claim because of some administrative problem. And so we
internal.
So we help them to go about how to file the claims. We provide assistance. Then for those that are really, if there's really violation, because as a hospital, they sign a commitment to PhilHealth that they should abide by the rules. So we could also check if there is a violation of this performance commitment.
And if there is?